Your gallbladder is one of the smallest organs in your body, yet it plays a huge role in helping you digest food every single day. Most people never think about it until something goes wrong, and by then, the warning signs have often been present for months. The frightening truth is that gallbladder problems usually develop quietly. Many seniors mistake the early symptoms for simple indigestion or normal aging, allowing the condition to become much more serious before seeking medical help. After the age of 60, the risk of gallstones, inflammation, and poor bile flow increases significantly. These conditions often begin with subtle changes that are easy to overlook, but should never be ignored. The good news is that your body almost always gives you early clues. Learning to recognize these silent warning signs may help you protect your digestive health before a small issue becomes a medical emergency. Today's video will reveal 9 silent warning signs that doctors say could mean your gallbladder is begging for help. Stay until the end because the final warning sign surprises many older adults. One of the earliest warning signs is pain under your right ribs after eating. It may start as mild discomfort but gradually become more frequent, especially after fatty meals. Many people assume the pain comes from overeating. However, repeated pain in the upper right side of your abdomen deserves medical attention because it may indicate your gallbladder is struggling. Another common sign is frequent bloating that appears after almost every meal. Even a normal-sized dinner may leave your stomach feeling swollen and uncomfortable for hours. Healthy bile helps your body digest fats efficiently. When the gallbladder isn't working properly, digestion slows down, often leading to excessive bloating and pressure. You may also notice persistent nausea without having the flu or food poisoning. The feeling may come and go throughout the day, especially after eating greasy foods. Some seniors begin avoiding favorite meals because they know they'll feel sick afterward. This isn't something you should simply accept as part of getting older. Another warning sign is frequent indigestion that doesn't improve with common antacids. Instead of occasional discomfort, it becomes a regular part of daily life. Many people continue treating the symptom instead of finding the cause. If indigestion keeps returning, your gallbladder may be trying to warn you that something isn't right. A sudden intolerance to fried or fatty foods is another important clue. Foods you once enjoyed may now cause pain, nausea, or severe discomfort within a short time after eating. Your gallbladder stores bile needed to digest fats. When it becomes inflamed or blocked, fatty foods often trigger symptoms almost immediately. Some people also notice pain that spreads into the right shoulder or upper back. This unusual pain pattern is surprisingly common in gallbladder disease and should never be ignored. The discomfort may come in waves and sometimes disappear completely before returning days later. That temporary relief often causes people to delay getting checked. Many seniors experience these warning signs for months without realizing they may all point to the same hidden problem. Early awareness could make a huge difference in protecting your long-term health. Ignoring these warning signs may allow a small gallbladder problem to become much more serious. Many older adults don't realize anything is wrong until the pain becomes severe enough to send them to the emergency room. One warning sign that deserves immediate attention is sudden, intense pain that lasts for several hours. Unlike ordinary indigestion, this pain refuses to go away and may continue getting worse with time. Some people describe the pain as sharp and stabbing beneath the right side of the ribs. Others say it feels like someone is squeezing their upper abdomen with incredible pressure. Another silent sign is waking up in the middle of the night with stomach pain. The discomfort may begin suddenly, even though you haven't eaten for several hours. Many seniors believe sleeping in a different position will solve the problem, but recurring nighttime pain should never be dismissed because it may indicate inflammation inside the gallbladder. You may also notice that your stomach feels unusually sensitive after every meal. Even foods that once felt light and healthy suddenly leave you feeling uncomfortable for hours. This happens because your gallbladder releases bile whenever you eat. If the flow of bile becomes blocked, digestion may become slower and much more painful than before. Another warning sign is frequent burping that seems completely unrelated to what you eat. It becomes so common that you hardly notice yourself doing it anymore. Excessive gas and repeated burping may seem harmless on their own. However, when they appear alongside stomach pain and bloating, they may point toward gallbladder trouble. Some older adults begin experiencing frequent episodes of acid reflux. Burning in the chest becomes more common, especially after dinner or when lying down at night. Although acid reflux has many different causes, poor digestion caused by gallbladder dysfunction can sometimes make these symptoms much worse than usual. Another symptom many people overlook is clay-colored or unusually pale stools. This change may happen because bile isn't reaching your digestive tract the way it normally should. Healthy bile gives stool its normal brown color. When that process changes, it may be your body's way of warning you that something isn't functioning properly. You may also notice your urine becoming much darker than normal. Even after drinking enough water, the color doesn't seem to improve throughout the day. Changes in urine color should always be discussed with your healthcare provider. While several conditions may cause this symptom, gallbladder disease is one possibility that shouldn't be ignored. Some people develop a mild fever that comes and goes without explanation. They assume they're fighting a small infection, but the real cause may be inflammation inside the gallbladder. If fever appears together with severe abdominal pain, nausea, or vomiting, medical attention should never be delayed. These symptoms can sometimes indicate a serious emergency. Another warning sign is pain that becomes worse every time you take a deep breath. The discomfort may spread toward your back, shoulder blade, or even your chest. Because this pain doesn't always stay in one place, many people mistake it for muscle strain. Unfortunately, that misunderstanding often delays proper diagnosis. Healthy digestion depends on a healthy gallbladder working together with your liver and digestive system. When one part of that system struggles, your entire body may begin feeling the effects. Fortunately, there are several simple habits that may help support gallbladder health. Eating smaller meals instead of large, heavy portions is often much easier on your digestive system. Limiting fried foods and highly processed meals may also reduce unnecessary stress on your gallbladder. Choosing lean proteins, vegetables, fruits, and whole grains supports healthier digestion. Staying physically active is equally important because regular movement helps maintain a healthy weight. Obesity is one of the major risk factors for developing gallstones later in life. Drinking enough water throughout the day also supports healthy digestion. Proper hydration helps your digestive system function more efficiently from morning until night. Never ignore repeated digestive discomfort simply because it comes and goes. Gallbladder problems often appear in episodes before becoming much more severe. Regular medical checkups become even more valuable after the age of 60. Ultrasounds and routine examinations can often detect gallstones or inflammation before dangerous complications develop. Your gallbladder may be small, but it plays a critical role in helping your body digest food every single day. Taking care of it now may help you avoid painful attacks and protect your long-term health. The most important message is simple. Your body is always communicating with you. Listening to these silent warning signs today could help you enjoy healthier digestion, greater comfort, and a more active life for many years to come.